You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer for Baptist Health South Florida, and we're coming to you live from the Baptist Health Newsroom. Mental health conditions affect everyone, yet there's still a lot of stigma attached to the subject. That stigma can make it particularly tough for men. With the way our society has conditioned men to keep their feelings to themselves and just tough it out, it's not surprising that many men can be reluctant to talk about their feelings or seek treatment to help manage their symptoms. May is Mental Health Awareness Month, and we have two experts here today to talk about men and their mental health. I'd like to welcome Dr. Rafael Rivas Vasquez, a neuropsychologist at Baptist Health. Welcome, Rafael.
Thank you.
And Dr. Kevin Wandler, who's the Chief Medical Officer at Advanced Recovery Systems. It's a pleasure to have you with us today, Kevin.
Thank you so much for having me.
Thanks to you both for joining us. Before we dive into today's subjects, I'd like to remind our viewers to send your questions and comments throughout the segment. We're here for you and happy to answer any questions you may have. So, Rafael, let's start with you. There's a common phrase that says men are from Mars and women are from Venus. Can you dive into that a little bit? What are the differences in men and women, how they may deal with mental illness? Are there different kinds of mental illnesses and how they may present between men and women?
Yeah, well, I think John Gray was certainly onto something, having sold, I think, over 15 million books. And I think that it speaks, to essential differences. And just want to say that it's probably not due to any one thing. We're probably looking at a confluence of neurobiology, anthropology, sociocultural issues that have resulted in what we see as the end game of basic differences in how men and women deal with emotionally laden stimuli and deal with their own mental health issues. And I also want to say that, we're talking in generalities. Certainly, there are men who are emotive creatures and are in touch with emotionality and are able to discuss things, and there are women that tend to be more stoic and not as emotionally present or expressive. But I think when we step back kind of statistically and look at the large groups, we can make some kind of generalized statements based on just what the science is. So we certainly know that when you look at the two most common mental health presentations, depression and anxiety, they are expressed up to 2 times more frequently in women than in men. So is that an actual difference? Is some of that reporting artifact of just women are more willing to discuss their depression when they're part of these large epidemiological studies? They're more willing to admit their anxiety, their sadness, their apathy, possibly. But the numbers are pretty staggering, and we're already, I think, on our 3rd large epidemiological study over the past 4 decades that show the same recurrent finding.
So Rafael, do you find in your practice and your colleagues, when a man presents with asking for help, are they usually coming in on their own volition, or is there someone else that prompted them to seek help?
Probably a little bit of both. And the presentations are a little different. I think women tend to want to come in prompted on their own accord. There are a group of men that would not be in front of us, a group, not everyone, that would not be in front of us if not for the behest of someone he's in a relationship with and has asked him to come in and get evaluated and treated.
So Kevin, let's elaborate on that a little bit. I think that's an interesting point. When someone is around someone who seems always happy, we tend to assume that they are mentally in a good place and they don't have any issues. Is that always the case? And if it's not the case, what will one see in someone else? What would someone see in a man, whether it's their spouse, a loved one, a coworker, that might be signs of that person struggling a little bit or having some mental health related concerns?
Yeah, great question. Definitely people that are smiling all the time aren't happy, all of them. Some are, I think where you see it, people have like a work phase. So they may be always happy at work. When they go home, that's where the truth comes out. So like Dr. Rivas Vasquez said, someone in their circle may be noticing their behavior changes. And so for men especially, they don't come up and say, I'm losing it, I'm depressed. They may present with irritability, anger, just going off the very low frustration tolerance. Certainly they lose interest in work or hobbies, if they used to go fishing or whatever, stop doing that. Start blaming people, projection, blaming everyone around them for all the problems in the world, or that are in their world, that is. And certainly with COVID, it really became quite an issue. It still is an issue. They would be maybe more likely to go in and see a medical doctor, or not a psychiatrist, but a physician, cardiologist, chest pain, racing heart, headaches, digestive issues. And my other world, I'm a psychiatrist, but I'm also addiction medicine, is certainly drinking like quadrupled during COVID as a way to cope with some of these stress. They identify anxiety and depression differently. It's irritability, it's can't sleep. And so alcohol they may turn to, or certainly other drugs of use and misuse.
Picking up on those great points, you mentioned a little bit, and I'm reading into it. Is it a change in personality, a change in do you pick it up mostly when you know someone well and you start seeing more irritable, a difference in their behavior, a difference in their personality? Is that something that triggers a little bit the signs that someone might be struggling?
Definitely, at the workplace or at home. I mean, if Johnny's always irritable and nasty, that's his baseline,
Right.
However, if he's the nicest person to work with, say, or a great partner, spouse, father, brother, whatever, and you suddenly see these changes, they can be signs of both depression or substance use disorder. I mean, the two are hand in hand there. Great question.
Raphael, so following up on that, depression, anxiety seem to be the most common. Confirm that if that's the case. I think you mentioned that at the beginning. What are some of the other mental health conditions that men can develop and present with that we would want to be on alert to identify?
Right. So, and I think the point was well made that while depression and anxiety, as the two most common conditions, tend to be expressed more frequently in women, men are going to express more substance abuse issues, are going to express more impulse control, more aggressivity, more externalizing behaviors. And those are the things that we need to watch out for. Cases in which there's been a behavior change, cases in which substance abuse has gone up. Again, we just need to make sure that we're monitoring folks, colleagues, our patients, looking for openings to intervene. And remember that going back to kind of neurobiology and anthropology, that there are structural and there are functional differences. We're wired a little differently. There are hormonal differences that are going to determine how men and women deal with conflict, deal with emotional arousal. So we're just not well equipped. It's the more evolved male that has access. Remember, dealing with emotional things and being able to talk about it, which we place a tremendous premium on being able to talk and express our distress. It's a two-phase issue. One is I need to be able to talk about it, but before that, I need to be able to experience it. I need to have that access to internal emotional life to be in touch with it and then talk about it. And a lot of men just shut things down.
Yeah.
Our neurobiology is such that if we can't solve it in the moment, if we can't deal with it right away, let's shut it down. Let's not let it get in the way of what we're doing.
It's fascinating. Again, the neurobiology, the chemical makeup of men and women actually contribute to the differences. I want to get to some societal stigmas in a second, back with you, Raphael. But first, Kevin, again, you both mentioned a couple of times men and women can express those mental health symptoms differently. Let's go back to that a little bit and make sure the viewers can see that. How do women generally present when they have a significant depression? And what do men generally present with? You guys brought it up and touched on it, but let's speak specifically to that. What would be the more common presenting symptoms with a woman versus a man with these types of issues?
Yeah, so women generally will come in saying they're depressed, looking sad, disheartened, expressing ruthlessness, problems keeping up with their job, whatever that is, or their duties. They may be a full-time stay-at-home mom. They may have a job outside of the home, and they start blaming themselves for, why things aren't going well. And then they also can experience drug and alcohol use as a way of coping, big time. And they would go to a psychiatrist or a primary care physician and ask for something to help cope with sleep and anxiety and depression. Primary care providers prescribe more antidepressants than psychiatrists because there's more of them and there's more access to them. For a male, again, we talked about it, it's irritable, it's anger, it's acting out physically, and certainly drugs and alcohol can contribute to that. But I do want to say something, both men and women have a common theme for contributors to mental health. Certainly many have a family history or genetics. Very important. Or we see a history of bipolar, we see a history of depression, anxiety, and alcohol use and substance use. Certainly many of my patients have had history of physical or sexual abuse, which can totally change how they see the world and how they cope with stress. A lot of history of bullying, especially in young people. We see suicide from that, loss of a loved one, of course. And then during COVID, many people lost their jobs, at least temporarily. And if you're a breadwinner, that's a huge blow to either male or female. Whoever the breadwinner is, you've got to support your family. And of course, drugs and alcohol problems I see them hand in hand.
So certainly in the cardiovascular realm, it's well established that women tend to ignore their problems, seek help later for various reasons, having to care for the family, worrying about the spouse more. Raphael, you mentioned there's some biochemical differences, men are from Mars and women from Venus. What about some societal concerns, the stigmas that may attach to a man seeking help for this area? Do you see that? Do you find that there's a stigma attached with a man complaining or recognizing may have some mental health issues and needs? And if so, why do you think that's the case?
It always comes back to three things: weakness, weakness, weakness. Men are perceived as being weak if they seek help. How often there's a certain amount of shame when a man sits in front of you to admit that he feels depressed, apathetic, maybe socially impotent, in the sense that we saw this over the past year with loss of job, loss of income, where men truly felt impotent and unable to bring about change and provide for the family. And there's a certain amount of shame, not only that they're going through it, but now I'm sitting in front of someone having to discuss it. It almost reifies the pain they're going through. And women seem to find true, genuine relief in connecting in that dyadic sense of I'm talking with someone, I'm receiving empathy from them. I've sat with men where they almost feel embarrassed that the empathy that you're showing them makes them feel good, right? I should be able to do this by myself. How many euphemistic phrases do we have? Pull yourself up by the bootstraps. It is what it is. What does that mean? Accept reality. Dampen out your feelings and keep moving forward.
And I can echo that from experience. As a physician leader, I've had to recognize these changes in some of my doctors and sat with them at this level. And at first there might be a little discomfort on their part, but then they'll open up and we can make them better. So I certainly echo that. going back to the COVID comments you guys made, Kevin, do you think, or have you guys, I'll ask both of you, but I'll start with Kevin, has COVID made it easier for men to open up about these stresses? We know the stress, the anxiety, the work-related, financial, the being closed in, the uncertainty of the pandemic, family issues, all the things that we can recognize can increase the stress, anxiety, depression, substance abuse. Do you find the pandemic has made it easier for men to recognize it and seek help, or have you not really seen any kind of shifts in referrals and requests for your guys' services?
Well, it's been discussed. There's been a lot more. Well, I guess it hasn't been discussed. There's been more depression and more anxiety since COVID hit, and so we may be seeing more men and/or women because of that. However, as soon as the pandemic hit, many resources disappeared. You know, mental health counselors' offices closed, psychiatry offices closed, and we went to something magical called telehealth. Suddenly it's everywhere. And that's a good thing. If anything good came out of this, that might be it, that insurers are looking at reimbursing for telehealth sessions. And so there's a group of individuals we see, and especially younger, and how do you define younger, I guess, is a relative term, but younger people really kind of like the telehealth part. They can sit in their room at home, do a session with a doctor or a therapist or counselor, and not have to worry about getting COVID. And this is especially before the vaccine came out, and actually get some care. So there's a group, but then there's a group of people that don't want to do this tele stuff, you know, and it's not real therapy. And there's others that find it easier to talk because, you know, I'm not in their space, you know, so to speak. I am, especially me, I'm 2,000 miles away, so or whatever. Anyhow, so it's a double-edged thing. So I'm not sure if it's actually gone up.
So we've created an environment where we can identify and increased drivers of mental health issues as we've decreased access. And now the telemedicine, the telehealth components might be resolving or at least providing that access back. Do you guys see, and I'll ask you first, Kevin, quickly, and then after that, do you see a generational shift? For example, is the younger generation more open, less open, the same towards, I'm talking about the men seeking help or identifying their own needs? Do you see any generational differences? I'll start with Kevin quickly.
Definitely do. I think younger people are much more willing to talk about their issues. It even goes to teenagers. Everything I said earlier about triggers for mental health and substance use is the same for kids. They get a lot of exposure to mental health because of suicides and the scary things that have been out there with, you know, the shootings and et cetera. And so younger people are getting more used to it. I think that the millennials, I have a couple at home, or they're grown up now, but they talk all the time about everything. I mean, and not because I'm a psychiatrist and I'm their dad. I mean, they talk to everybody about everything.
More expressive. Yeah.
More expressive. 65-year-old plus, not so much. And they're at really high risk men that have maybe now are no longer working because of just aged out or are unable to get depressed. They may have lost their partner if they had one or spouse. Family is distant, et cetera, are really high risk. And if you have an elderly male, or anyone for that matter, who's talking about suicidal ideation, those guys will do it. Yeah. You know, they'll follow through.
Why are men more likely to die by suicide than women? Any thoughts?
Yeah, they use more violent means.
Yeah.
You know, women tend to use cutting and pills, you know, and there's certainly cries for help. I'm not minimizing, and people can die from those things, but less likely to.
So it's not the rates of suicide are different, it's the success of the suicide.
Yes.
That's different. Yeah.
Women actually attempt suicide more than men. But men are more successful because a gun, you know, you really, it's one and done, you know, unfortunately, and hanging, et cetera, more violent means.
Very, very scary.
Yeah.
So Raphael, let's switch gears as we wrap up with a couple of points. we've identified the differences between men and women, both in how they present and how they address their own mental health needs. Let's talk about a little bit what we can do to help people. When someone seeks help, what's the benefit of such? What is seeking help? What does seeking help and getting help look like?
First and foremost, assessment regarding level of acuity, symptom severity, what's the right treatment, what's the right diagnosis, and then what's the right treatment to prevent further decline, to alleviate distress, to correct any impairment. So again, the assessment and the prescription as to what's the appropriate treatment always leads the way. The two primary treatment paths are medication, psychotherapy, or counseling, or a combination of both. And depending on the patient, you individualize that plan to make that determination. But clearly, there's tremendous health benefits to be able to come in, get the correct assessment, and get the adequate treatment initiated to restore functioning, alleviate distress.
I think that's well said. It's the customization. You can go online and read stuff, but the clinical assessment is your particular circumstances, your needs, your benefits, your treatment. So we would want to encourage that. Do you find when someone seeks help that means they will be on medications or treatments for the rest of their life? Is that a guarantee?
Not necessarily. And I can defer to Dr. Wandler on this as a psychiatrist, but not everyone that comes in, first and foremost, is going to need medication. And then of those patients in which it's indicated for medication, depending on the degree of the duration of illness they've had, if they've had prior episodes of depression or anxiety, that's gonna dictate how long they're gonna be on treatment. And again, not everyone needs medication, and not everyone benefits from psychotherapy necessarily. There's just some folks who aren't kind of wired that way, and that's that customization of who's going to benefit from which modality, either monotherapy or combination.
Understood.
Dr. Wandler?
Yeah, Dr. Rivas Vasquez certainly brought up some great points. Most depression that I've worked with is cyclic, or once, we have like a COVID pandemic. Many people are actually having post-traumatic stress disorder from this because of all the consequences of the pandemic, from isolation to distancing to masking to vaccinate or not to vaccinate. I mean, there's a lot of issues there. And if they've had depression before, responded before to medication and therapy, and I like the combination personally, they're likely to have a short-term situation. However, if they've lost their job, if there's a series of social circumstances, they may be having to come in for quite some time. My goal is trying to get people off of medications in 6 to 9 months if possible, as long as they're in therapy also.
Understood. Something I think that could support our viewers, Raphael, I'll actually ask both of you as well. So now you have a loved one or a coworker or someone you're exposed to who you think is having problems, or that person may even hit rock bottom and reach out to you. How can one support a male friend who is having mental health issues?
Yeah, the past year with COVID has given us plenty of opportunity for friends and colleagues to approach us. First, make sure that there's, in that initial interaction when they're reaching out to you, that there's support and reinforcement of how important it has been for them to reach out to you. Share a little bit of your own distress during this time as a way of connecting with them, and encourage them to seek professional help. Try to destigmatize it, try to normalize it for them, and really try to encourage as much as possible. If they're not comfortable seeing a mental health professional, have them at least talk to their PCP as also an alternative path. Getting them to see a psychiatrist or psychologist is optimal, or any mental health professional. But at the very least, once they've reached out to you, if they're not willing to do that, have them connect with their PCP.
And the primary care can either help them or help expedite a connection
Correct.
to, which is worthwhile as well. Kevin, what about the individual who might be recognizing or trying to determine if they have help, if they need help? What would their first step be?
Well, I think, if they're having thoughts of suicide, that's a big deal.
Okay.
And we certainly have them call something like the National Suicide Prevention Lifeline. And I think you're going to give the number. I'll give it now too. It's 800-273-8255 for support. And there's a lot of different crisis management phone places out there that people are able to access. It's all regional. And so if someone's in a different state than Florida, their resources may be different. But the suicide helpline is national. And so that's really important. And then I try to encourage people, if this was a friend, okay, well, let's start doing some simple things. I mean, for me, COVID was a time of stress, anxiety, loneliness. And so how do I deal with that? Well, let's just do simple things. Go to the grocery store, And my poor cashiers hated seeing me because I chatted them up and someone live to talk to, I'm married. My wife sick of listening to me for the last year. I mean, it's a whole different thing. Walking, just taking walks, trying to reduce stress. We took up walking again, sharing what I've done. I've done 3 miles a day every day since COVID. I used to travel a lot. I've only traveled twice since COVID began. So some little things like that can also help. And then those resources, if you call those helplines, they'll also give them more resources local in their community.
So these are actually great points, and actually speaks to the first question we'll take from the audience, which you just alluded to. What are the little things men can do other than talking to someone? You mentioned getting out, taking a walk, little exercise. We could talk about sleep and whatnot. So Raphael, what are the things people can do in their lifestyle to either prevent or mitigate early forms of anxiety, depression, and other issues? Are there more things that people can do to take it into their own hands and help themselves?
Yeah, for milder presentations, healthy lifestyle, exercise, get plenty of restorative sleep, and connect, social connectedness. Make that effort to reach out to others. Now is not the time to isolate. So physical, some really nice data on positive brain reactions to physical exercise and activity. So I think those 3 things are things that we can do on our own prior to accessing care.
Are there any dietary supplements that have been shown to be able to eliminate or control depression, anxiety, and other mental health issues in men?
Maybe in milder states, tryptophan, SAMe. Overall, just a Mediterranean-rich diet is probably, with antioxidants, is probably good for brain health anyway.
Right.
And also, now's not the time to be drinking a lot.
That was going to be my next question, but I was going to give it to Kevin, and I have spoken about it in the past. So yeah.
Yeah, we have.
Talk about actually, before you get to that, how about caffeine? Is caffeine at all related to stress and anxiety? Does it help or decrease symptoms? Does it improve, make it worse? Any thoughts on that?
For myself or Dr. Warren?
Yeah, for you.
Yeah, no, I think at low levels, it can be activating and helpful for wakefulness and for attention, but do not overdo the caffeine, because that's just going to jack up your level of stress and anxiety and jitteriness.
Right. So let's finish up with just some comments on alcohol from both of you. Start with Raphael. Social drinking, a drink to relax you, positives, negatives, when we would recognize it's a little bit too much and might be contributing.
Right. And remember, so some of these folks may actually be recovering from COVID, and there's a nice emerging body of literature on brain fog, and certainly decreasing toxins around this time is very important, especially for those folks. But, drinking in moderation, knowing the signs of alcohol abuse, which is that maladaptive recurrent pattern that you're drinking and you're getting into conflicts, it's producing problems for you, and yet you don't curtail your drinking. So maybe a drink to relax and as a social lubricant around which to engage with others is fine, but you need to really be careful not to overindulge and overdo it.
Kevin, any final comments you'd like to make, and specifically regarding alcohol? I know it's, as I said, something we've talked
Certainly,
about.
it's what I do all day long, was work with people with this. And I think that the guidelines out there have been for women, 1 drink a day is considered okay if you don't have an alcohol problem, liver problems, et cetera, of course. And for men, it's about 2 drinks a day on average, just due to metabolism, muscle size, et cetera. So when you start teetering over that, it may be a problem.
Yeah. Well, again, this is incredible insights you guys have shared. And I really thank your expertise and thank you for your expertise and time. To the viewers, if you're thinking about suicide or worried about a friend or loved one or would like emotional support, please call the National Suicide Prevention Lifeline. It's a great resource, unfortunately underutilized. The number is 1-800-273-TALK. That's 1-800-273-8255. Remember, viewers, you can connect with us on our social media channels. That's Facebook, Instagram, Twitter, LinkedIn, and check out our resource blog for the latest news at baptisthealth.net/news. That's baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health podcast as well. On behalf of everyone at Baptist Health, we ask you to stay safe and stop the spread of COVID-19. Thank you.
Thank you.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.